Hi, this is Danny and Haley, and we did our presentation on cranberry juice. Cranberry juice is made from cranberries, one of the native fruits of North America. Cranberries have tremendous amount of antioxidant capacity as compared with other vegetables and fruits such as broccoli, spinach, or apples. 1 cup of cranberry measures a total of 8,983 antioxidant capacity. For comparison, apples have 1,500 milligrams of antioxidant vitamin C. Cranberry juice made from the fruit extract or cranberry concentrate is used to make various sauces and cocktails. These cocktails are approximately 28% pure cranberry juice mixed with artificial sweetener or fructose. About 1 liter of juice can be extracted from 1,500 grams of fresh cranberries. The fruit extract is also used to make medicine, gels, and tonics. The effects that cranberry juice is thought to have is it's supposed to protect against memory loss and lack of coordination, prevents tooth cavities, cures sore throats and colds, helps avoid respiratory infection, prevents blood clots, reduces risk of stomach ulcers and kidney stones, strengthens bones and teeth, effective against lung infections, and then it's greatly known for giving relief from UTIs. Then it's also known to help the heart. The effects that cranberry juice. So people that would use cranberry juice include those who struggle with memory and lack of coordination, want to improve their dental hygiene, have a sore throat or a common cold, frequently get respiratory infections, want to avoid stomach ulcers, tumors, or blood clots, currently have a UTI, if they simply just like the taste, or if they want a healthier option to mix in an alcoholic beverage. So people that would use So a little bit about the side effects, adverse drug reactions, and warnings with cranberry juice. As some of the possible effects are continued pain or burning when you urinate, vomiting, or severe stomach pain, or if you get signs of a kidney stone, which are like painful or difficulty with urination, pink or red urine, nausea, vomiting, waves of sharp pain in your side or back spreading to your lower stomach or groin. Other things that you need to be cautious of when you're taking this drug or when you're taking cranberry juice is if you're on warfarin, which is an anticoagulant drug used as a blood thinner, and it lowers the chance of blood clots occurring in the body. These blood clots can further result in serious conditions like cardiovascular disorders or clots in the legs, lungs, or other parts of the body. Guidelines for warfarin clearly state that people who take the drug should be cautious regarding the intake of cranberry as they are at a high risk for bleeding. Also, be cautious if you have an aspirin allergy. Cranberries contain substantial quantities of salicylic acid, which is also present in aspirin. People who take blood thinners and are prescribed aspirin should avoid consuming too much cranberry juice because the intake of cranberries should be restricted if you are allergic to aspirin. Kidney stones. Cranberry extract contains a significant concentration of oxalate and calcium. This amplifies the chances of developing calcium oxalate stones and uric acid stones in certain people. People who have kidney stones or have a history of kidney stones should consult a medical professional before consuming cranberry supplements or a large amount of the juice. Inflammation of your stomach lining, which is atrophic gastritis. So cranberry juice can increase how much vitamin B12 the body absorbs for people with atrophic gastritis. Also diabetes. Some cranberry juice products are sweetened with extra sugar, so if you have diabetes, you should stick with cranberry products that are sweetened with artificial sweeteners. And then also low stomach acid, because cranberry juice might increase how much vitamin B12 the body absorbs. So some medications are changed and broken down by the liver. Some research suggests that cranberry might decrease how quickly the liver breaks down some medications. Taking cranberry along with some medications that are broken down by the liver can increase the effects and side effects of some medications. Some of these medications include the ones that are listed within this black box. So an overview of cranberries on urinary tract infections. People often think that cranberries can help treat the UTI that they already have, but in reality, cranberries are not proven to be effective at treating UTIs, but rather at preventing a future UTI. Cranberries are thought to have chemicals that prevent bacteria from sticking to the urinary tract, which then prevents a UTI from occurring. So we looked at two different studies on cranberries on urinary tract infections. The first one was in elderly women. So they had 153 women in a nursing home that averaged around the age of 78, and they used either 300 milliliters of cranberry juice versus a placebo. And then this resulted in reduced frequency of bacteria after just 1 month of drinking cranberry juice. The other study that I looked at was in younger women. They used 150 sexually active women between the ages of 21 and 72. Before the study, all the participants had at least one UTI per year. So in this study, they compared cranberry tablets, cranberry juice, and then a placebo. In the two groups that used cranberries, so the tablet group and the juice group, they had a 50% decrease in their yearly UTIs. Another study / popular opinion on cranberry juice is that it actually increases the amount of salicylic acid in the body, which can then help reduce swelling, prevent blood clots, and have anti-tumor-like effects. So, in regards to recommendations as family members and not as your future physical therapist, we would recommend to our families to drink cranberry juice in an acceptable amount. We find that the benefits outweigh the risks of drinking cranberry juice as long as it is not in excess. If anyone in our family were taking warfarin, aspirin, or a drug that we had mentioned earlier that is broken down by the liver, we would tell them to talk to their doctor about an appropriate amount of cranberry juice that they can have. We would not recommend that if they did have a serious health condition such as a UTI, that this would be their only choice of treatment. However, we would recommend that it could be used in conjunction in an appropriate recommended amount by their physician. Okay, these are our references. Thank you for listening.